Doctor, in the last video, we briefly touched on comedian Lee Se-young's breast filler side effects. Do fillers always cause side effects?
For a while, many patients underwent breast augmentation using either autologous fat or fillers. But over time, various problems began to arise. Today, I'd like to address those concerns and questions. Hello, I'm Dr. Kim Koo-kyun, a board-certified plastic surgeon at Human Plastic Surgery.
Doctor, when you first heard about Lee Se-young's breast filler complications, what were your thoughts as a specialist?
First of all, I felt sorry to hear about it. Fortunately, there are also many people who live safely with fillers. However, the breast is different from the face or other body parts. It's a hormone-sensitive organ and contains mammary glands. So the size and shape of the breast change during menstruation, and even more during pregnancy, childbirth, and breastfeeding. Therefore, inserting foreign substances into the breast must always be done with caution. To begin with, there are no fillers officially approved for use in the breasts. That doesn't mean it's illegal, though. Many doctors use body type or large volume fillers off-label, meaning fillers approved for the face are used in other areas at the doctor's discretion. So, injecting fillers into the breast isn't illegal, but it's also not guaranteed to be safe. Unlike the face, where 1 to 2 cc is typical, breasts often require 150 to 200 cc per side. When such a large amount is injected into one area, the filler can migrate, cause inflammation, or lead to infections. There have even been reports of sepsis in some cases. So while it can depend on the type of filler, large volume filler injections definitely require regular follow-ups.
Doctor, then is fat grafting safer?
Personally, I think fat grafting is better than fillers because it uses your own tissue. But don't get me wrong, I'm not saying fat grafting is ideal either. It's just that, after seeing many filler complications, I consider it the lesser of two evils. I don't recommend breast fat grafting, especially with volumes over 200 cc. Another misconception is about doing fat grafting on top of breast implants. In that case, the location, amount, and purpose of the graft are different. It's not about injecting fat into the breast parenchyma or glandular tissue. Injecting a controlled amount into the subcutaneous layer around the implant for specific purposes can be okay. Back to fat grafting, there's a limit to how much volume it can add to the breasts. If too much fat is injected, it can enter the parenchyma, form lumps or cysts, and even calcify over time. So I personally do not recommend high-volume fat grafting. Another reason I don't recommend fillers or fat grafts is that you can't guarantee 100% removal. Even dissolvable fillers can form capsules and migrate into normal tissue when used in large amounts. They can also adhere to tissues, making complete removal very difficult. In such cases, removing them as safely as possible is crucial for protecting healthy breast tissue. That's why surgery should be done by an experienced plastic surgeon to safely remove as much as possible without harming healthy tissue. If you're worried about breast fillers or fat grafting, please visit a nearby clinic for an ultrasound or mammogram. If any issues are detected there, or if you want more precise testing, CT or MRI scans are also options. CT technology has advanced recently, making it a quicker and easier option. The news is can even measure the volume of tissue within your mammary glands. Start with basic tests like ultrasound, mammogram, or X-ray. Then move on to CT or MRI for more detailed results if needed. Even if there are no current symptoms, if you've had non-dissolvable or large volume fillers, especially those recently flagged, I strongly recommend removal. Personally, I believe implants are the safest and most reliable method for breast augmentation. So, I recommend breast implants for augmentation. However, there are implants that better suit each person's body type. And depending on your current breast shape, specific implants may be recommended. So instead of going in with a fixed idea of what implant you want, it's better to have a consultation and choose from what the doctor recommends. That's the safest and healthiest way to undergo breast surgery. For those who have received high-volume fillers or fat grafting, it's most important to maintain breast health through regular checkups. Just to be extra cautious, if you've received fillers, silicone, or other substances from unlicensed clinics or illegal procedures, please get examined and consider removal as soon as possible. That's the best way to protect your breast health. This was a serious and heavy topic, but I wanted to explain it in a way that's easy to understand. I hope today's information was helpful to you. This has been Dr. Kim Koo Kyun from Human Plastic Surgery. Thank you.